Good morning, everyone. My name is Angela Zaccanini. I am a registered dietitian here at the Wellness and Integrative Oncology program on the third floor of Hillman Cancer Center. Every Wednesday, the last Wednesday of every month, we're going to do a live Q&A. So you are welcome to include your questions in the chat. I did include my email at the bottom of the screen, so that if you would rather send me your questions via email, you can do so, and I can address it during our next live session, which would be the last Wednesday at 9 a.m. in November. So I wanted to get started with a few questions that I commonly get asked as a dietitian, not only in the oncology setting, but just in general. So the first question I get asked is, how much protein should I eat in a day? So to answer that question, it isn't black and white, of course. Everything is in this gray area. Now, it is very specific to the patient, the person that's asking. It depends on any comorbidities. What are their goals? Is it to gain muscle mass? Is it to promote immune function? Is it to put on weight? So there's many things to consider here, but there is a general rule of thumb. So whenever patients ask me how much protein should they get in a day, typically I convert their weight to kilograms, and then I multiply that by 1 to 1.2. So that can give me at least a little estimate of what their daily intake should look at or look like. So if there are other things to consider, for example, kidney function, if they're in renal failure or where they have a kidney infection, their protein needs actually decrease. So that's one thing to consider. If they are planning for surgery or if they have an open wound, their protein needs will increase. If they're on active treatment for cancer, again, their needs are increasing. If they're trying to promote weight gain and muscle mass related to activity, those needs increase as well. So again, very individualized, and if you meet with a dietitian, you'll be able to get that answer for yourself, and then maybe keep track of certain things. So we talk a lot about the protein content of food. So for example, a 3-ounce portion of meat is about 20 to 25 grams of protein. So if your goal is about 60 grams of protein a day, if you're eating your 3 regular based meals with a source of protein at each meal, you should meet those needs, okay? Another question I get is about being vegetarian or vegan. So this is a very common question across the board. And I tell patients that they don't necessarily need to become vegan or vegetarian if that's just not within their wheelhouse, but choosing more plant-based options is going to be beneficial. So here in the United States, we have, I guess our diet is more convenient, a lot of fast food, a lot of processed foods, minimal whole grains, fruits and vegetables. So that's the first thing I tell patients. Increase your intake of fruits and vegetables and whole grains. So high fiber. We want to increase our fiber intake. Not only that, but we want to incorporate some plant-based proteins in. Beans, lentils, nuts and seeds, soy-based proteins like soy milk, tofu, tempeh. So if you can increase those things, you know, there's always a balance. You can still consume meat and dairy, and even the occasional sweet, but if you incorporate more fruits and vegetables, more of those things I just mentioned, you're going to incorporate more anti-inflammatory foods into your diet, more vitamins and minerals, overall benefit. So like I said, you do not need to become vegan or vegetarian, just increase your intake of plant-based foods. The final question I'm going to address today is being concerned about dairy and inflammation. This is a very common question as well. Kind of leaning into that vegan and vegetarian. So a lot of patients ask me if they should be avoiding dairy. And to be honest, my opinion with dairy products is to consume organic or high quality, to eliminate that intake of hormones and antibiotics utilized in the process of dairy foods. So if anything, try to spend that extra few dollars on the higher quality dairy products. You do not have to eliminate them. The only reason why you would need to eliminate dairy is if you have a food allergy or an intolerance. And that's really with anything. There's always room for everything in the diet, and that's why a lot of us dietitians say everything's okay in moderation, whether that's dairy, that's sweets, that's meat, and processed meats, that's snack type foods. There's room for it, but you should keep certain things a treat and other things a staple. So again, just to reiterate, dairy is okay. I encourage choosing organic or high quality products when it comes to that. So another thing about that is that, dairy is a great source of protein. Greek yogurt has 3 times the amount of protein than regular yogurt. Milk is a great source of potassium, calcium, and it also is a great source of protein. So fit it in when you can, and don't be afraid of dairy and inflammation so much as to, getting a balanced diet, okay? So if you have a question, please include it in the chat. If you don't have a question today, or if you're just kind of thinking now that we've had some conversation, please feel free to email me. My email again is at the bottom of the screen. We will meet again the last Wednesday of November to do this Q&A, and I'm just going to start to keep track of common questions I get asked. So if nobody has a question, I'll be able to address those here. Okay, so we'll see you next week, next Wednesday, for another cooking class. And then again, we'll see you in the following week, or the following last Wednesday of the month, for another Q&A. Thank you. Have a great day.